allergies, and today I want to spend a little time talking about topical applications, applying the herbs in salve form to the outside of the body for saturation of an affected area. This is an excellent herbal support to use for infections, for wrenched areas, for healing arthritic conditions. We have a line of salves that is excellent for any number of issues. And I think what I'll do is just quickly go over the different ones that we have and just give you some idea of what they can be used for. Okay, one of our newer salves is called M&L, the Mullein and lobelia salve. This is an excellent topical anti-spasmodic. It was originally, I developed it into a salve to use over a goiter on the throat, and then found out that the properties are excellent for any spasm, opening up the lymphatic system. Several years back, I took an accident and wrenched my neck. I got some whiplash and found that this was excellent in stopping the pain within less than a minute. The horrific pain that was in my head stopped. It just eased the muscles, relaxed the muscles, let the blood flow back into the brain. It's great for migraine headaches, anything that's tension where the muscles are tight and causing restriction of blood flow. This will relax it. It's also been used to release locked joints. It's just proved to be amazing. And like I said, it was one of Dr. Christopher's recommendations for goiter. And because I know that most of our members are not going to do hot fomentations, make the tea, get your hot washcloth, put it over the affected area and change it out, all that, it's very time consuming. And making it into a salve and just applying that, and it's one application, you put it on overnight and it works beautifully to help clear and saturate the tissue without the over procedure of doing fomentations, hot fomentations. Another one that we make is called our infection salve. This has been used very effectively for all types of topical infections. You can use it as wound care when you're dressing an injury, bandaging it. It'll also work great for, it's going to clear the bacteria and the infection out of the wound so the wound can heal. So it's also very good for decubitus ulcers and issues like this where you need to get the bacteria cleared and the infection cleared so that the wound will actually close, because the wound will not close if there's an active infection in it. So getting that cleared out, and there are other procedures also, charcoal flaxseed poultice, things like that, to pull the infection out, get that cleared out, get it purified, so that then we can use the herb to topically heal and close the wound. But infection salve is excellent for anything like that. It's also wonderful for bug bites, spider bites, not the recluse, that's a little intense, but ant bites, things like that where you've got a sting, a pain. It's got the plantain in it, which will definitely support getting the swelling down and taking care of bee stings, wasp stings, ant bites, things like that. It works very well. Okay, another one that we make is Jewelweed. Jewelweed is nature's antidote for poison ivy, poison oak, stinging nettle, any of those things. It's also an excellent anti-itch. I've used it very effectively for people with psoriasis or itchy skin issues. It will just take the itch away and really calm down the burning skin and all that. It's an excellent aid. I also, chickweed is one that you want for inflammation, like a diaper rash or things like that when you're dealing with infants. or just something that has inflamed your skin, chickweed is very valuable on that also. And we do make a chickweed salve. But jewelweed is nature's antidote for poison ivy, poison oak, all those things. If you get out in that on a yearly basis, you definitely want this in your medicine cabinet. Okay, another one that we make is called the A&R salve. This is arthritis and rheumatism. This formula can be taken, applied topically, and we also, it can be taken internally, a mix of the herbs. This will take down the inflammation. It dissolves the urea crystals, which create the inflammation and the pain in an arthritic joint. And applied as a plastered over the affected joint overnight, leaving it on, will do wonders for clearing the inflammation and the pain associated with your inflamed joint. So the A&R salve is an excellent aid for clearing the inflammation, to rebuild the joint, to clear the arthritis. You want the BF&C, the bone, flesh, and cartilage formula. This formula contains the comfrey, which knits the body back together. It clears, it has properties that will help clear inorganic mineral deposits and just help knit the whole body back together. The BF&C is also wonderful for any soft tissue injury. Applying it right after, packing it over the area right after an injury, quite often by the next morning it's like you didn't even do it. This is excellent aid for any twists, turns, any soft tissue injury. It's also excellent for broken down skin, varicose veins. In the case of varicose veins, what you have is a condition where the skin has lost its elasticity and the veins are allowed to float to the surface, causing them to show, and varicose veins. This formula will take and strengthen the tissue so that the veins can be pulled back into position in the middle of the tissue, and the varicose vein condition will disappear. And it usually works fairly quickly. I had a real big one on the side of my knee years ago, a nice big fat varicose vein that had come out, and it was quite painful. And it was less than a week of applying the BF&C, and it went away and it's never come back. But it works for spider veins, for the big ones. It just strengthens the tissue so that the flesh, so that the elasticity comes back and the veins are then pulled back into position in the middle of the tissue. So that's the BF&C. It's an excellent support for pretty much any condition with the skin where you want to strengthen and heal and restore the skin. All right, one thing I wanted to go and show today, a lot of people don't understand when I say do a pack with the salve. I'm just going to make a little bit of a pack here and just give you an idea of how it's done. This is flannel and press and seal wrap, which I really like because it sticks to the skin. It has a sticky side, so it will stay put all night. Okay, let me just cut off. You want 2 layers of flannel, and so I'm just going to cut. This is a double piece here. I'm just going to make a small little pack just to demonstrate. Okay, get your press and seal wrap. It's a little more than I need for a little piece, but hardly the point. Like I said, one side is sticky, and you can tell which one it is. This is the sticky side, so you put that side up, and then you just place your 2 layers of flannel. I've got two pieces here. Place those in the middle of it, and it'll just stick down. And then you just take your salve, and you would just place it a nice amount on the pad that you've made here, and try to keep it on the pad. This salve came from a batch that came out a little runny. Normally it will set up a little bit stronger than this, thicker, but this will work for a good demonstration. Breeze is coming in. Thank you, dear. Alright, then what you're going to do is just pick this up, and let's just say that I sprung my wrist, or I'd want to wrap it completely around my wrist. But this is a case where I actually have a piece that's a little large for what I'm wanting to do here. Let me just cut this down a little bit. There we go. All right. Reposition this thing in the middle. There we go. That'll be a little easier to use. And you're just going to take your pack and apply it over the affected area. Like I said, if I had sprung my wrist or had a painful wrist, this would work very well. I actually do have a painful thumb right now from my embroidery. I overused my thumb, and I've been doing BF&C on it at night. Alright, well, it hardly matters how pretty it is when it goes on. But as you can see, what I wanted to demonstrate was how well this actually adheres. It is on there. But it does not tear the skin. When it comes off, it just peels right off very easily. So even if you're dealing with an elderly person or somebody with very thin skin, you're not going to tear or, as people sometimes do, pull the skin too much and cause damage to the skin when it comes off. Another thing is I'm very allergic to adhesive, and the adhesive on the press and seal has never bothered me. And I have used this in very tender places on my body where normally adhesive would just inflame me really bad. And the press and seal has never been a problem as far as adhesives go. So that is basically how you do a pack. If you were working with a garter, you would put it over your neck. If you've got neck injury, you can just plaster it over the neck, around, put it around the neck, over a knee, anywhere. Putting the pack on is not difficult, and it stays put all night. I mean, you can get up and move around. The pack is not coming off. I have found at times when I put it on my knee, it doesn't seem to be wanting to adhere well, but if I just sit there for a few minutes, it really does stick. Just make sure that the skin is clean and that you don't let the salve come off the pack, so that you don't grease your skin up, because then it won't stick. But that is a brief overview on our salves and on how to apply them. If you have any questions, feel free to call the office or email me. The email will be at the bottom of the screen. And you all have a great day, and subscribe to us if you like these.